You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey vet rehabbers! Now, obesity is a massive global problem, and it's the number one health problem faced by pets today. The prevention and early recognition of obesity, as well as correcting it when it is present, is very important. Today's podcast is a snippet from a previous Vet Rehab Summit lecture. Our Vet Rehab Summit is our online veterinary rehabilitation conference, and it is this year on the 4th of November. Online Pet Health members, you get free VIP access to the summit. If you're not a member, you can always purchase day access. Kenneth Joubert talks about the local and biological effects of obesity and why it's so important that we consider them when we have overweight patients we are trying to rehab. Kenneth has an M.Med vet in anesthesiology, and he has done a number of lectures for us. These are all in the library. There was 4 webinars and a series on pain, which was really, really brilliant. If you haven't checked that out, you need to, Online Pet Health members. Also, a deeper look at non-steroidal anti-inflammatory drugs, and another webinar on the long-term use of opioids and alternatives. Before we head over to the podcast, I just want to say a big thank you to Callie Charles from @VetPhysioFile. Thanks for the shout out, Callie, about the veterinary rehabilitation podcast on Instagram. Please can you email me on meg@onlinepethealth.com for your limited edition veterinary rehabilitation mug. All right, I'm looking forward to this one. Over to Kenneth.
Thanks very much, Michelle. And today we're going to have a chat about obesity and its implications. And certainly obesity has some dramatic effects in anesthesia, which is one of the aspects that interests me when you deal with and you anesthetize obese patients. And I'll chat a little bit about that right at the end of this talk. But obesity certainly is becoming a bigger and bigger problem across the world. And if you have a look at this recent editorial that was published from the Veterinary Record that's out there, there's a dramatic increase in obesity, and there seems to be a correlation between obesity in our animals we see and in humans, and a suggestion perhaps that we should treat this as a common problem. So the big question that we need to start to ask is, what is the prevalence of obesity in animals? And this is some marketing material that comes from the Hills Company, but it's certainly out there that more than 50% of animals are obese. And that's an important problem, and we'll talk about that in our talk today, about the pathophysiology of obesity, what it does to our body, what the negative effects are of it. But perhaps the other things that this advertorial highlights is owner awareness is incredibly poor, and it's incumbent on all of us to educate owners about pet obesity. 9 out of 10 owners of overweight pets mistakenly identify their pets as being normal. That's important. Doing weight checks, 30% of owners never check their pets' weights. So if we have these opportunities to intervene, we should utilize it. And it's all about education and perseverance. And my last couple of slides will deal with that, because getting patients into weight loss programs is absolutely vital. People don't always follow it, but what is the situation then in the US? And this is from the 2018 Pet Obesity Survey in the United States. Just under 60% of cats are obese, just over 55% of dogs are obese. So very much exactly what you saw in that marketing material that is there. But getting pets to lose weight is important. And how do we do that? Through calorie restriction and increased exercise. And of course, as veterinary rehabilitators, you can play an important role in exercise, maintaining, encouraging, and promoting exercise amongst animals. I'm not going to talk about how to lose weight, but I'm going to talk about the clinical effects of it. What I do think is the distribution of obesity that's different between dogs and cats. And you notice here with dogs, this is again from the United States survey there, that moderately overweight dogs, and then of course the severely obese dogs, form sort of a smaller and smaller group. But very few animals are thin, which is great. If you start to look at cats, for example, the trend is slightly different. There's a lot more morbidly obese, very obese cats compared to those that are slightly overweight. And they're almost equal to the normally weighted cats that are out there. And that's something to bear in mind. So if you are dealing with cats, obesity, in actual fact, a lot more of them are grossly obese, whereas in dogs, the trend is slightly different. So as we start to enter now and deal with the next aspect to it, I'm going to show you this human study first, but it deals with the loss of life due to obesity. It's not something that we think about, but in actual fact, the effect can be quite dramatic. So I'm showing you this little graph here, and along the bottom axis, the y-axis, is all the different body mass index scores, and across that is the years of life. If you look at all the clear blocks, the white blocks, those are young adults, 20 years of age, and a morbidly obese white male who's got a body mass index score greater than 45 can lose more than 12 years of their life by just being obese. Women tend to lose less. So the same category of women would lose about 8 years of their life that is lost. That's actually very, very significant. And just to show you that there are differences between different race groups, genetics play a role. For example, if you take a young-aged black person, they can lose nearly 20 years of their life if they're morbidly obese. So this is something that is clinically very, very significant and important. We know from veterinary evidence that's out there, and this is done on studies, for example, with Labrador retrievers, that if they are kept lean, they have a significant increase in median lifespan of nearly 2.5 years. That's significant in dogs. If we work out that each year is worth 7 years of life, that's nearly an extension of somewhere in the region of 18 years. So by looking after and controlling weight throughout a dog or a cat's lifespan, we can make them live a lot longer. And what I'm going to start to talk about in a couple more slides' time is why do they have the shortened lifespan? What are the consequences of obesity that leads to this reduction in lifespan? But as a parting thought here, it's again a human study. Body mass index in excess of normal is responsible for the loss of 95 million lost years of life in mankind. And if obesity continues at its current rate, life expectancy for US adults may in actual fact decrease in the future. Currently, over the last 100 years, people have been living longer and longer. And the effect of obesity in humans may be the effect that they actually start to live shorter and shorter. But let's get back to veterinary medicine again. And it's important to realize in the beginning that what causes obesity in animals is multifactorial. Admittedly, animals get fed by us, so mankind actually plays a very, very important role in obesity in animals. And those factors in the obesity, for example, include things like personal income, the owner's age, snacks and treats that they feed, the amount of exercise the dog receives. But there's an important interaction between our patient's obesity and how the humans interact with it. And so when we're treating obesity, it's not only about dealing with the animal, it's also dealing with the owner and getting compliance with them to get a weight reduction. And so they've identified a number of factors that are associated with obesity in dogs. For example, dogs that sleep in their owner's beds are often more likely to be obese. The feline cartoon character Garfield, who is a little bit obese, and his attitude to life makes people think that they want an obese cat and establish it as normality. And so what breed societies do and so on set as norms also may play a role in what we perceive as being normal with it. Right, so how does it affect our animals? And for those of you who've listened to my talks on osteoarthritis and some non-steroidals will realize that obesity is an important cause of osteoarthritis. And if we don't control weight, we increase our patients' risks for osteoarthritis dramatically. If you looked at the limited fed groups, for example, they have a relatively low incidence of osteoarthritis, only 4% at 2 years. By the time they reach 18 years of age, about 14%. But if they become obese or overweight, that incidence can approach 60% by the time they're 8 years of age. So we dramatically increase the incidence of osteoarthritis in obese dogs. So the control of their weight early on in life is absolutely important. For the same reason, in osteoarthritis, weight management is an effective and important component of managing dogs with hip dysplasia and associated osteoarthritis. And so we need to become very aware of it and to manage it. So having set the scene now for obesity and what obesity is, we need to deal with that. Obesity is defined as the accumulation of excess body fat. That's all it is. Just more body fat than what is normal. And that's great. In people, hopefully we're relatively more uniform than what we have in companion animals. But in companion animals, we have dramatic variations in breeds, sizes, etc., that we define obesity by means of body condition scores. And there are body condition scores tables for both dogs and cats. And we should use those to body condition score our patients. We want to keep them, and this is the World Small Animal Veterinary Association's diagrams for it, an ideal body condition score of 4 or 5, maybe just pushing to a 6. But certainly we want none that are 7, 8, or 9, and we don't want any emaciated animals either. 1, 2s, or 3s is also not necessarily healthy. So we should use these body condition scoring for all our patients that come in, evaluate them for obesity, record their weights, and record their body condition scores. Because by using those two, we can get an idea of how overweight they are or how much weight they actually need to reduce. So this is just a CT scan, just to show you what an obese animal looks like. That's the picture B on the right-hand side of the curve, and you'll notice all the intra-abdominal fat. And I want you to start to think about this pathophysiology that happens. Having all this fat inside your abdomen pushes against your lungs, and so your lung fields are reduced. And it has respiratory implications, but it has health implications, and that's what we now need to start to deal with. Obesity has numerous co-associated morbidities with it. And there's a number of risk factors that are associated. Certainly certain breeds seem to and appear to be more associated to develop obesity. Labradors, golden retrievers, Manx, and certain of the domestic short-hair species are predisposed to it. Gender, sterilization status. Generally sterilized animals become obese. Age. Older patients are more likely to be obese than those that don't exercise. And we, as owners, feed our animals. And so the source of food does play an important role in obesity, especially how much we feed, and perhaps more importantly, that last little point there says snacks. It's not only what we feed them, it's all the extra tidbits we give them. There's always been this debate over commercially fed diets, and of course there's now a very big uptrend in raw fed diets as well. They themselves have not always consistently been shown to be a risk factor, but it's also important to feed a balanced diet and meeting the energy needs of a patient. What's most interesting out of this survey is that the price of the pet, the more expensive the pet is, the more likely it is to be obese. But these are diseases associated with obesity, from osteoarthritis to endocrine functions, respiratory tract diseases, oral diseases, diabetes, which is also an endocrine disease, all the way down to neoplasia and anesthetic risk. They're all associated with it. And how do we get there? So we need to have a look at what the fat actually does. And the fat, believe it or not, is a master endocrine organ. It has significant interactions with multiple factors inside the body. These go from interleukins, for example, those are inflammatory mediators, tumor necrosis factor. So it's able to institute inflammatory responses. It has effects on the adrenergic systems. It affects angiotensin, which is all involved in water retention, for example. Some of the vascular and endothelial growth factors, which is how they may play a role, for example, in tumors. We've got adiponectin, which we'll talk a little bit more about, because it also, that with leptin, regulates our appetite. That is there. Can affect our steroids in our body, complement. It's actually quite a wide-ranging effect that fat has this interaction. And of course, it's these interactions of fat that eventually lead to compromise of other organ systems within our body. And so the list of diseases is ever and forever expanding. My first picture there was the Pickwickian man of the Dickens era on my opening slide. But do we recognize it in animals? And certainly we can, and we can see it. but intervertebral disc disease. All these diseases can be aggravated by obesity. So, how does this all start to fit together? And how does it work in terms of the management of these patients? And this is how appetite is regulated. Anorexigenic versus orexigenic, your desire to eat, are controlled by centers within your arcuate nucleus within your brain. And they talk to centers within your hypothalamus. So if, for example, you have a meal, your glucose levels rises, insulin will then rise, and insulin, of course, then has an anorexigenic effect, removes your desire to eat, and your appetite disappears because your glucose has risen. And there's a number of hormones or mediators that will play that role, and they regulate in the balance between that. In humans, you can go out and get more food. You can pick up another chocolate bar, eat another tub of ice cream. Fortunately, our animals can't do that. They can't open the fridge. They can't feed themselves unless most often we help them, excepting if they go scavenging. So although appetite is controlled within animals, they don't have the access to food. And that's why people play an important role in obesity in animals. In people, for example, as you become more obese, this control is disrupted because of the hormones that are secreted by the fat. And therefore, you start to eat more. Even though you have more than adequate amounts of food, you can continue to eat. It almost becomes physiological. So you can now see an extended list of the hormones that are involved in the control of your desire to eat and not to eat. And as you notice, there's a number of adrenergic hormones will make you want to eat. So your flight and flight response increases appetite. But then a whole lot of substance involved in digestion and gastric function, for example, will all suppress appetite once they become active after a meal. And it's not a simple thing. And this is what makes perhaps dieting incredibly difficult, because it's a very complex mediated system between your desire to eat and your desire not to eat. And of course, once it becomes dysregulated, and it becomes a big problem because people can just access food. But let's start to look at the consequences and how these consequences are in actual fact mediated. How fat cells play a role in multiple diseases that are out there. So one of the things that certainly plays a role is diabetes is linked to obesity. And diabetes is linked to obesity by means of what the fat does. So if you have a look at a lean person, lipolysis is usually relatively low. Adiponectin as a hormone is relatively high or raised. And the inflammatory mediators that come out of that, the fat cells that come through there, are usually interleukin 10, 4, 13, and they promote insulin sensitivity. But as you become obese, that changes. Adiponectin decreases, lipolysis starts to go up, you get hypertrophy of the adipocytes, and the inflammatory mediators change. Tumor necrosis factor, interleukin 6, and suddenly you get insulin resistance. And this has in actual fact been shown in cats. So this is just the area under the curve for insulin, depending on how obese the cats are. So between 0 and 60% increase in weight. And then, of course, cats that had 100% increase in weight. And the area under the curve for the insulin goes up as the cats become fatter and fatter. They become more resistant to insulin because of obesity. And what is diabetes? Diabetes is either about insulin resistance or the failure to produce insulin. So in humans, they use the definitions of type 1 and type 2 diabetes, or insulin dependent or non-insulin dependent diabetes. And that's why some of the drugs that we can use increase the sensitivity of our cells to insulin, because you actually still produced insulin, but it's just not effective. And there, weight plays an important role. But we have evidence in our animals that it also plays an important role. So you increase your risks of diabetes by becoming obese. So weight control, we can eliminate or reduce the incidence of a disease through weight control. We need to have a look, and we're going to have a look at multiple organ functions, but obesity plays an important role in inflammation in our body. And it's perhaps one of the more important mechanisms that fat regulates and has its clinical effects that are there. So if you have a look, leptin regulates our food intake and our energy expenditure. In obesity, it goes up. That's down there, but adiponectin decreases in obesity, and that regulates our glucose and our lipid metabolism, as we looked at with diabetes. But we get all the pro-inflammatory mediators, and we discussed that with osteoarthritis about how, for example, feeding omega-3 fatty acids or DHA and EPA, for example, we could get a more anti-inflammatory response, whereas obesity generally generates a more pro-inflammatory response. And that inflammatory response has significant effects on a number of organ systems. And that is in actual fact very, very key to what happens and how organs fail with obesity. So if we have a look at adiponectin then and its role that it plays, bearing in mind that in obesity, its levels go down. So it promotes beta cell survival. That's, for example, in your pancreas, that relates to insulin and insulin production. If it decreases, more cells are going to die off. It decreases glucose and decreases lipogenesis. So the opposite effect happens in obesity. It goes to the opposite. It has an anti-inflammatory effect through changes in the immune system. So a decrease will in actual fact promote inflammation. It's these inflammatory effects that have significant effects on other organ systems in our body. But that's what I'd like to do over the next couple of slides, is look at the effect that obesity has on organ function. And it's not in any particular order that I've done them, but lungs are important, and I always have big problems under anesthetics with obese patients because they cannot breathe. And that's maybe why I started with the lung function and the effects on lung function. Unfortunately, there's very little evidence in veterinary medicine on studying this. So you're going to see a number of human studies intermixed with a couple of veterinary studies in between in the next couple of slides that deal with this aspect because it's not as well researched, excepting on an experimental basis. But the first thing that obese patients lose is they lose functional residual capacity. Their lung volumes get smaller. And what that means is, if you think about it simply, is the fat, for example, from the abdomen pushing forward on the diaphragm and compressing the lungs. And that leads to closure of the airways. And by reducing that, you start to lead to hypoxia. So you also get narrowing of the central airways. Whereas if you lose weight, all of that is quite reversible. And that's why weight reduction is so important. You increase your functional residual capacity and you can get a larger tidal volume and breathing. Under anesthetic, that's important to me because if you don't breathe in any of the inhalation agents, you don't sleep. So obese patients don't sleep. And the way that we get around it is I usually ventilate them because they cannot maintain themselves. And that's great. Under anesthesia, we have an ET tube in, for example. We have control of their airway and we can ventilate them. But when they wake up, there's a point where you have to take that ET tube out. And because of their smaller tidal volumes, they're prone to hypoxia during recovery. And that's where one of the big problems we have is waking up these obese patients. It increases their morbidity and their risks. So if you have a look at, for example, lung functions, and this is done on human, they have dramatic decreases in lung functions in obese patients. Losing weight returns that lung function towards normal again. So your pulmonary function is significantly reduced. How do we avoid it? Don't become obese. Does it affect your cardiovascular system? The answer is obesity can lead to heart failure. And many of these things with obesity, by the way, are interlinked. So we talked about the effects of obesity on lung function, and poor lung function leads to hypoxia, and hypoxia plays a role in the cardiac failure again. By compressing your lungs and having hypoxic means you get your pulmonary hypoxic reflexes activated, you get pulmonary hypertension, and that can lead to right ventricular failure. They talk about that classic Pickwickian person who breathed in these short stifled breaths because they battled to breathe, but they often died of heart failure. What also happens in obesity, by the way, is your circulating volume goes up, which means you place more strain on your cardiovascular system because they have a rising cardiac output. And that, of course, eventually leads to left ventricular enlargement, hypertrophy, and down the line to left ventricular failure. So both types of heart systems can actually fail, both your left heart and your right heart, because of obesity for slightly different reasons. Just bearing in mind the systemic vascular resistance plays a role. And I'll show that to you in a couple of slide times. Obese patients have increases in sympathetic tone, adrenaline, so they become more vasoconstricted as a response, which means you increase the resistance to outflow of your heart. But the effects on the heart can be actually incredibly broad. In humans, of course, who get coronary artery disease, and it's a common problem in humans, heart attacks with atheromatous plaques that rupture, causing a heart attack, obesity plays a role in it because those atheromatous plaques contain fats and lipids within them which come from obesity. But relevant to our patients, by the way, is not only the diagram I showed you earlier with changes in cardiac output and vasoconstriction leading to hypertension. The inflammatory cytokines play an important role. Myocardial fat leads to myocardial fibrosis, which affects cardiac function. And of course, diseases like diabetes do not help cardiac function. Sleep apnea is an interesting one, and I didn't touch on it with the respiratory function, but if you look at the classic bulldog, they've been commonly used as a research subject for sleep apnea. And those dogs are often feel as though the owners make them obese. And of course, that significantly affects their airways, which is their only method of cooling. Again, the hypoxia, because of poor lung function, will lead you down towards right heart failure. But obesity also has effects on the cardiac rhythm. And again, there's a number of factors from the fat adipokinins that play a role, epicardial fat. Yes, atherosclerosis, as I say, we can largely ignore that in the animal patients because it's not important. Changes in sympathetic tone, diabetes can lead to abnormalities in cardiac conduction. So the effects of these diseases is actually quite ranging and very, very significant. Something we need to actually think about how it affects us. This comes from the National Cancer Institution. It's just one of their diagrams, but there's a number of cancers associated with obesity and overweightness in humans. The honest truth is we don't have much evidence in animals, and it'll take us a long time to accumulate this type of evidence within animals, but it's important to think about it. We'll touch on kidneys a little bit later because there's significant effects there as well. But things like meningiomas, adenocarcinomas of the GIT tract, kidneys, pancreatic tumors, colon and rectal tumors, liver tumors, we can go through the list, which we could significantly reduce by changing diets. And so if you look at the human data, more than 84,000 new cases of cancer were probably preventable if people weren't obese. The percentage of cancer cases attributed to obesity varies, but it could be as high as 40%, particularly for esophageal and endometrial cancer. As I say, we don't understand this currently in our veterinary patients, but hopefully with time, we will increase the evidence that is there. But if you have a look at the factors, and if you go back to that little cartoon I showed you right in the beginning with all the hormones that fat can interact with, insulin-like growth factor plays a role. So it's something that we need to think about in terms of enhancing function. Does it affect our brains? Well, the answer is yes. And there's a number of diseases that have been associated with obesity in humans. In animals, do we have as much evidence? The simple answer is no, we don't. But the pathophysiology starts to make sense. And so obesity, for example, is a risk factor for Alzheimer's disease and cognitive impairment. And I'll show you why in a couple of slides, because there's an effect on the myelination of nerves. But adipocytes that are hypertrophied with altered adipokinin secretion and the inflammatory mediators that come on it alter fatty acid flux within the central nervous system. Not only do we get an increase in sympathetic tone, which leads to some of our cardiovascular problems that we have, but you actually increase your risks of polyneuropathies as well. Added to that is the effects on diabetes, which also affects peripheral nerves. It's not well described at all in animals. But the effect in the top slide, by the way, deals with the control of feeding, so between your arcuate nucleus and your hypothalamus and why we eat. But the part B of it is about how nerves are affected by obesity, myelinated and thin myelination, the loss of myelination within the nervous system, or the changing of that myelin because of obesity. So it can alter nerve function that is there. And so if you have a look at certainly the things that have been described in humans from obesity, and the consequences thereof include things like brain atrophy. Admittedly, perhaps we would never detect it in our patients. Humans have fine motor coordination, vast amounts of memory and communication and problem-solving skills that are easy to identify small changes in cerebral function. So it's more difficult for us to detect it in animals. But the other things include cerebral ischemia, altered brain metabolism, that's down there, alterations in mood and anxiety, chronic activation of sympathetic tone results in changes both within organs that we've talked about, but gastroparesis, intestinal dysmotilities. The list is actually quite endless. And as I say, I think there's a vast amount of work that needs to be done in veterinary medicine for that. What about kidney function? Obesity and kidney disease, the hidden consequences of an epidemic. But certainly, obesity can lead to renal failure. And again, we see the hormones adiponectin and leptin. Leptin goes up in obesity, adiponectin goes down, along with things like resistance and the other cytokines, then interact with things like the insulin resistance, the renin-angiotensin-aldosterone. If you remember back, fat cells themselves can activate angiotensin. The inflammation, the oxidative stress, that interacting with diabetes mellitus, by the way, and cardiovascular disease, because those are cofactors for it, leads to chronic kidney disease. Certainly a problem in humans. And the question that I have here is, humans will live 70, 80 years easily these days. Animals don't quite live as long. So are we going to see this as a problem? The potentiality is there that we can see these as a consequence. And we know that those Labradors live 2.5 years less if they were obese. Is it a component of a whole lot of other organ systems that get disrupted that leads to the early demise that they have? Obesity, and this unfortunately once again is a human study that comes from it, non-alcoholic fatty liver disease is what they refer to it as, is rapidly becoming the most important cause of chronic liver disease due to the increase in the prevalence of obesity. So humans, there's a whole lot of people who get alcoholic liver failure. So this is all the other people that happen. And again, it becomes a complex situation between fatty infiltration into the liver, fatty acids, oxidative stress. And this, by the way, is a diagram to look at therapies that they could introduce to control it. If any of you have ever dealt with cats and they become anorexic, they often get fatty infiltrations in their liver as well. So there may be exciting drugs into the future which could help us with anorexic cats. But this plays a role. We get dysfunctions from an hepatic perspective. So multiple organ systems are in actual fact affected by it. This is my slide on anesthetics, just so that you know. And by the way, if you are emaciated, your mortality is in actual fact higher than if you're obese. So it's important to have an optimal body condition score for anesthetics. But as you become more obese, from overweight to moderately obese until you're morbidly obese, your morbidity dramatically increases. And it's really only the morbidly obese who have an increase then in mortality as such. So there is an effect, but morbidity increases. In other words, adverse events happen. You may not die from all of them, but it's certainly going to increase the costs of healthcare. There's no doubt about it. They require more monitoring. They require far more attentive looking after them when they recover because of effects on pulmonary and cardiac function as they recover. So I hope by now what I've enabled you to do, without boring you with all the details of mediators, is to start to show you the scope of the organ systems that are affected, all the way from osteoarthritis to some endocrine functions to important organs, are all affected by obesity. And it's all controlled by weight loss. And that's perhaps the most important role that all the people out there as rehabilitators, veterinarians, and everybody involved in treating patients is to get patients onto weight loss programs. And it's important to create an environment of change. And this has been a recent proposal that's been come out of there, assessing the readiness for change that it is. And it's a combined effort of people, to the pre-contemplation, to read them through that, to make them aware of the problem. Looking back at the Hills data, 9 out of 10 people didn't know their dog was obese. It's an educational problem. About doing those conditions and those body scorings to get them into the contemplation where they become aware of the problem. It's about talking to them. If you keep your Labrador thin, he'll live 2.5 years longer, so you'll have more time with him, and you've significantly reduced his risk for osteoarthritis. That's really a great motivation to, in actual fact, get them onto weight loss and to get them through the process of making that decision and acting on it. And once you get them to start to act on them, it's important to keep on encouraging them through a weight loss program. Absolutely vital to do it. Keep on encouraging them and assisting them and supporting them through that processes, because otherwise you're going to get lapses, and that's important. So once they start to lapse, all your good work will be undone if they've lost weight. So obesity is a problem. And these are just some slides to show you how bad it can be. Weight reduction is important. Keep your patients thin. If you have a look at that dog, bearing in mind all dogs cool themselves through their airways. So with reduced lung function because of obesity, their ability to cool themselves in hot weather is dramatically reduced. If you have a look at the prevention and early recognition of obesity, as well as correcting obesity when it is present, is essential to the appropriate health care and increases both the quality and quantity of life for our pets. And it's trying to get that message across is absolutely important. And I'm sure many people today will highlight various aspects of it and how we can use weight loss in the management of diseases, because it carries risks for diseases. Thanks very, very much for listening to my talk.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. Don't forget to bookmark the next Vet Rehab Summit on Saturday, the 4th of November. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Onlinepethealth members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.